Hi, today we're going to be talking about Kawasaki disease, and we're going to be looking at what a nurse's responsibilities are when a patient has this disease, or if a patient presents with the possibility of having it, and what we would look for in order to be able to help start to diagnose it. Obviously, the nurses wouldn't be doing that, but we would start taking a look at some of those focused assessments in order for to relay the information to the providers. And we would also, what we would tell the patients and their parents while we would be figuring this out, and then what to expect for treatment and then after the disease has subsided. So let's get started. So if a patient comes in and we start to do our assessment and note that they have a high fever of over 37 degrees, we might ask the parents how long that is. And if it's over 5 days, that is a signal telling, maybe there's something more. And we would obviously take a look at their heart rate, their blood pressure, all the vitals, and looking for any outliers. They might have tachycardia. That's another fever symptom. And we would, we would look at the patient and how they are presenting as a whole as well. The 5 major signs of Kawasaki include the redness of the eyes, and no pus in them or anything, but they would have that conjunctivitis. And we would also be looking for redness and inflammation in their oral mucosa, as well as that classic strawberry tongue. It would be bright red, beefy tongue. Going down further, we're going to look at their neck and look at their lymph nodes and look for the inflammation in their neck here. That's another one of the big signs for this. We would be looking at their skin. They would have diffuse rash and itchiness throughout. They're like little rashes throughout the body that just show up all over the place. They might also present with the itchy hands and feet, or maybe their hands and feet are peeling. The peeling skin is another big sign and symptom of Kawasaki disease. Things would look like little like that. So that's the strawberry tongue there, and those are some of the peeling hands and the redness in the eyes, and then as well the skin rashes and such. So those would be the first few clues. We would also order a couple of blood tests in order to be looking for any inflammation markers, and some liver tests looking for anemia and inflammation, and looking for those elevated proteins. So from there, if everything looked to be in that direction, the provider would order an echocardiogram in order to look at the heart and look at those coronary blood vessels, looking for any enlargement of the heart or any aneurysms in those blood vessels, to know how this has progressed and if that is the diagnosis of what this patient has. So from there, if the doctor has decided that this patient has confirmed that this patient has Kawasaki, they would order a treatment of a 2 grams per kilogram immunoglobulin IV therapy. So that would be administered to the patient, and along with some aspirin to try to reduce that fever. And typically it should be one IVIG treatment, intravenous immunoglobulin treatment, for them to expect that over about 3 hours to a day, depending on the size of the child. And then they may have to do a repeat if the fever does not subside within 1 to 2 days. And then from there, the disease usually lasts about 3 to 6 weeks, depending on where the patient is throughout the process. It has to go through all the cycle of the disease. And then afterwards, the patient has to follow up with cardiology if there is any coronary enlargement or aneurysms or anything. And throughout their life, they should be doing periodic checks with a cardiologist as well.